The one that arises from the sacrum is piriformis. Here it is. Piriformis arises from here on the sacrum. It leaves the pelvis by passing through the greater sciatic foramen, along with the sciatic nerve. We'll go right round to the back to see where it comes out. Here's piriformis emerging. It inserts here, high up on the medial aspect of the greater trochanter. Piriformis is an important muscle to understand because it's closely related to a very important structure, the sciatic nerve. Now we'll look at the two obturator muscles, obturator internus and externus. They lie on each side of the obturator membrane. Here's obturator externus. It arises from the obturator membrane and from the adjoining edge of the ischiopubic ramus. Obturator externus passes backward just beneath the neck of the femur. Here's its tendon, passing laterally to reach its insertion here, below piriformis. Next we'll see obturator internus, which comes around the back of the ischium here from inside the pelvis. We'll go around this way to see where it arises. Here's obturator internus. It arises from this wide area on the ilium and ischium, and from the obturator membrane. It leaves the pelvis through the lesser sciatic foramen. As it passes round the back of the ischium, obturator internus does a 90-degree turn. As it makes the turn, it's joined above and below by these two little muscles, gemellus superior and gemellus inferior. They arise from the ischium here and here. Along with obturator internus, they're inserted here. The last of the short rotators is quadratus femoris. Quadratus femoris arises from the ischial tuberosity here and inserts on the femur here on the intertrochanteric crest. All these short rotator muscles have the same action. By pulling the back of the femur medially, they produce this movement, lateral rotation at the hip joint. When the foot is on the ground, the same muscle action produces what appears to be a different movement, rotation of the trunk to the opposite side. The adducting muscles all arise from this region on the ischium and pubis. And they're all inserted along this line. The lowest one, gracilis, right down here on the tibia. Let's start with the named adductors. Here's the largest of them, adductor magnus. Adductor magnus arises from the outer border of the ischiopubic ramus. Its insertion is in two parts, with a gap in between. The upper part of adductor magnus inserts here on the linea aspera. The lower part inserts here on the adductor tubercle of the femur. The gap in adductor magnus is the adductor hiatus. The main blood vessels to the leg pass through here from the front of the thigh to the back. The other two named adductors, brevis and longus, sit in front of adductor magnus. Here's adductor brevis. Here's adductor longus. Brevis arises here on the body of the pubis. Longus arises here. They're inserted on the femur right next to adductor magnus, brevis above, longus below. The insertion of adductor longus stops just short of the adductor hiatus. The other two adducting muscles are a short muscle, pectineus, and a very long muscle, gracilis. Pectineus is the shortest of the adductors. It arises from this line on the superior pubic ramus. It inserts here, just in front of adductor brevis. Gracilis is the most medial of all the thigh muscles. It arises here on the pubis, and it's inserted all the way down here on the tibia. The main effect of all these muscles is to produce adduction at the hip joint. The knee can either act at the hip, at the knee. Here are the short rotator muscles that we've seen already: quadratus femoris, obturator internus and the gemelli, and piriformis. Now we'll add gluteus minimus to the picture. Gluteus minimus arises from this part of the wing of the ilium. It's inserted here on the front of the greater trochanter. Overlying gluteus minimus is gluteus medius. Gluteus medius arises from this part of the ilium. It's inserted here on the outer aspect of the greater trochanter. Though gluteus medius is mainly an abductor, as we'll see, its anterior part also produces medial rotation at the hip. The fascia lata is a continuous sheet of dense fibrous tissue that surrounds all the muscles of the thigh. Along the outer aspect of the thigh, there's a very marked thickening of the fascia lata called the iliotibial tract. The iliotibial tract extends all the way from here on the ilium down to here on the tibia. Here's the iliotibial tract by itself, with the rest of the fascia lata removed. These muscles, in front of it and behind it, we'll be looking at in a minute. Between the muscles is a strong fibrous septum which attaches the iliotibial tract to the femur. At its lower end, the iliotibial tract is attached down here on the tibia. The iliotibial tract acts as the tendon of insertion of two muscles. A big one back here, gluteus maximus, which we'll see later, and this one, which we were just getting ready to look at, tensor fasciae lata. Tensor fasciae lata arises from the iliac crest, here. It inserts here on the iliotibial tract. The three hip abductors move the limb to the side. When the foot is on the ground, the hip abductors, pulling down on the ilium, raise the opposite side of the pelvis up. This tilting of the pelvis happens in a small way each time we take a step, making it easy for the opposite foot. Iliacus arises here from the iliac crest, psoas major from all the way up here on the lumbar spine. Here's psoas major. Psoas major arises from the transverse processes of all 5 lumbar vertebrae and from the sides of the intervertebral discs and the adjoining vertebral bodies. We'll see its insertion in a moment. Here's iliacus. Iliacus arises from almost all of the inner aspect of the wing of the ilium. As they pass downward together, iliacus and psoas major pass over the superior pubic ramus and under a structure here that we haven't been introduced to yet, the inguinal ligament. The two muscles pass downward and backward and insert together down here on the lesser trochanter. Contraction of the iliacus and psoas major produces flexion of the hip joint. When the limb is free to move, flexion brings the thigh forward, body upright. First, let's briefly review the muscles we've seen already: psoas major and iliacus, pectineus, adductors brevis, longus, and magnus, and gracilis. Now let's add quadriceps to the picture. All this is quadriceps. It's the main muscle that extends the knee. The only part of quadriceps which acts as a hip flexor is this part, rectus femoris, It's the only part that arises from above the hip joint, which is here. Rectus femoris arises by two heads, from here and here, just above the acetabulum. Its final insertion, along with the other three heads of quadriceps, is right down here on the tibia. Rectus femoris is quite a weak hip flexor. Now we'll add the last hip flexor, sartorius. Sartorius is a very long, narrow muscle that lies outside all the others. It runs in a spiral, starting here on the anterior superior iliac spine and ending up all the way down here on the tibia. Sartorius helps to flex the hip. It can also produce lateral rotation at the hip. Now we'll move on to look at the four muscles that extend the hip. The first three, which are known collectively as the hamstring muscles, act at the hip and at the knee. The fourth one, gluteus maximus, acts only at the hip. We'll come to it last because it lies outside the others and covers them up. Here's the back of the thigh as we saw it last. Here's gluteus medius. Here are all the short rotators. Here's adductor magnus. And here's the back of quadriceps. The three hamstring muscles all arise from the ischial tuberosity. Here they are. Two of them run to the medial aspect of the leg. One runs to the lateral aspect. The lateral one is biceps femoris. The two medial ones are semimembranosus and semitendinosus. Here's semimembranosus by itself. It has a long, flat, membrane-like tendon of origin, which arises from here on the ischial tuberosity. It's inserted here on the back of the tibia. Here's semitendinosus, lying behind semimembranosus. It has a long cord-like tendon of insertion. It arises from here, next to semimembranosus. It inserts down here on the medial aspect of the tibia, close to two other muscles that we've seen already, sartorius and gracilis. Now that we've seen the two semi-muscles, we'll add biceps femoris to the picture. Biceps femoris has two heads of origin, a long head and a short head. The long head arises from here on the ischial tuberosity, along with semitendinosus. The short head arises from almost the whole length of the linea aspera, and from this supracondylar line. The two heads of biceps femoris join together, forming a tendon that runs down behind the lateral aspect of the knee, then runs forward to insert here on the head of the fibula. Here's the upper end of the hamstring muscles. Here, overlying them, is gluteus maximus. It's a thick, flat sheet of muscle. Gluteus maximus arises from here on the back of the ilium, and from the side of the sacrum, and from the sacrotuberous ligament. The upper 3/4 of gluteus maximus inserts into the iliotibial tract. The lower 1/4 of gluteus maximus passes more deeply and inserts here on the back of the femur on the gluteal tuberosity. Now let's look at the actions of the hip extensor muscles, starting with the hamstring muscles. Contraction of the hamstring muscles can produce both knee flexion and hip extension. When knee flexion is held in check by the action of quadriceps, the hamstrings just produce extension at the hip, which is the action that propels us forward in normal walking. The action of gluteus maximus extends the hip from a position of full flexion, as in climbing stairs or rising from a squatting or sitting position. The same action. Then the action of gluteus maximus pulls the back of the pelvis downward, raising the body from a forward bend at the hips, or when balanced